to our third CovidEd town hall. The CovidEd project is a collaboration between the Boys and Girls Club of Atlantic City, the Southern New Jersey Perinatal Cooperative, the New Jersey Department of Health, and AtlantiCare. This is aimed at helping Atlantic City's families stay protected during the pandemic. My name is Michael Davis. Today I'll be your moderator, as well as talking about protecting our families. I'm also one of our community educators trained to answer your COVID-19 related questions and to help connect you to services you need to get tested and vaccinated. You can contact a community educator at covid.ed@acbgc.org. Nosotros hablamos español. This is our third of 4 CovidEd town halls, all of which will be available on both the Boys and Girls Club of Atlantic City YouTube channel. At the end of this town hall, we will be putting the names of everyone who attended in a hat that will be picking the winner of a set of Apple AirPods.
Okay, perfect. Okay. Well, thanks everyone for indulging. We got a little confusion on the front end. We had a ceremony going on for George Floyd, and I had to put forth a few comments. So I'm multitasking today. So I'll make this pretty quick. Today, I'm going to just talk about some of the basic facts about COVID, and then Dr. Hocbo can talk about some details from AtlantiCare. But let's go right into it. I wanted to talk about the etiology of this thing called COVID-19. It's certainly a novel virus, comes from the coronavirus family. It's primitive in nature, meaning that it's not an advanced virus, but it's very contagious. What I mean by that is this virus is unable to replicate on its own based on the genetic material and structural composition of it. Some of the first cases, as you may know, started out from direct exposure in Hunan seafood wholesale market in Wuhan, which was where there is suspicion that it may have came from a lab, may have gone into an animal, into a human, and then back to an animal and back to a human. So in either case, something happened in China, and this virus crossed over different species, and as a result, we're dealing with a international pandemic. As of late 2020, we had emergency use authorization for at least 3 vaccines that could help reduce the impact of this coronavirus. And that's the Moderna, the biotech, which are 2-dose vaccines, and the Johnson & Johnson, which is a 1-dose vaccine. There also is movement right now to get full authorization of the BioNTech. So we're moving in the right direction. Unlike the severe acute respiratory syndrome, which is SARS virus, COVID-19 virus has multiple spikes, and this thing is unique in that it can stick to any surfaces, including a stainless steel surface. So I like to cover this because a lot of people think that, oh, it's over. It's not over. The virus is still out there. It can be spread through airborne. That means anyone that has the virus can spread it to others through sneezing. This virus has been documented as being able to spread up to 27 feet. So we're still in the storm. So don't second guess the fact that we are still challenged with this coronavirus. As of May this month, there are numerous strands. We only hear about 3 on the news, but there are numerous strands of this virus. We hear about the South African, the EU virus strand, and the original strand, but there are actually thousands of these strands out there right now. It was declared a pandemic the end of December, and also as of March 11th last year, after over 114 countries were exposed and 4,000 deaths, we recognized that this thing was moving fast across the world. This virus attacks the body at multiple points of entry, through the nose, through the mouth, through the eyes, and has an incubation period about 3 to 7 days. It can be up to 2 weeks, and the symptoms are probably going to present themselves on average about 12.5 days into it. We've deployed 2 strategies to handle this virus. therapeutic strategies. One is a supportive strategy, which we started out initially last year, doing testing and diagnosing and what we call antiviral pharmaceutical treatment and what they call non-pharmaceutical interventions. Those are things that you can do to boost your immune system. And also, if you did progress to a point where you had to go to the hospital, ventilator-assisted treatment. All those are supportive strategies. And then now we've also deployed prevention strategies, which are social distancing, which you've heard a lot about, isolation, aggressive isolation, quarantine. These are all things we can do that we can all participate in to reduce the spread within our community. And I'm going to speed up a little bit from here and go on into this virus. As I said earlier, this is a transmission cycle of the virus. May have came from a prehistoric animal, went into a human, and then back into the animal and spread from human to human through droplets. It attaches to the ACE receptors in your body. We have them all over our body, in the blood cells, muscle, everywhere in our body. We understand the structure of it. We studied the structure of this virus, so we learned how to kill it. And although it's microscopic in nature, the best way to kill it is to be able to break that purple structure around this microscopic organism. And if you don't break that, you can't kill it. So we've got a lot of chemicals out there that can break that structure and kill this virus. The other thing I put this slide in to help you understand that when we test for this virus, it has a double positive RNA, which is what we look for with the COVID testing. So much like a pregnancy test, we look for that. This virus is microscopic in nature, is very sensitive even to ultraviolet rays and heat. We move on. One person can infect an entire community, and that's a fact. So that's one of the reasons why we have to continue to be protected. Although, our governor has pledged to relax the rules as of this Friday. Those of us who know how contagious this virus can be, we still need to practice safe habits so that we don't allow this thing to find a host, because once it finds a host, it can spread. What you see here is that an initial infected adult can spread it to a child, and a child can spread it to other children, and it becomes pretty much widespread very quickly. So that's one thing to keep in mind. As far as communities of color, early on, we were seeing that this virus disproportionately affects communities of color, meaning our death rate was double or more within communities of color. That trend has shifted, by the way. There's a reason for that. Communities of color are Black Americans or African Americans, Latina, Asian Pacific Islanders, and indigenous people. These are people that has kind of olive skins or black or other dark skin that have melanin. And melanin does two things. Sometimes it protects us from the sun, but it also protects us from the natural vitamins from the sun, which is vitamin D3, which means less sun exposure, less potential of having a strong immune system, higher propensity to be exposed because you have a weak immune system. So that's one of the things that we've been telling people early on, that immunity is a real factor in terms of reducing this spread and preventing this thing from attacking you and harming you, especially if you're from a community of color. There are also, within communities of color, we are notorious for having these underlying risk factors, especially those of us who are 45 and older, and things like obesity, high blood pressure, kidney disease, asthma, congestive heart failure, HIV, AIDS, other immune deficiencies. This is the kryptonite. The coronavirus look for those folks who have those underlying risk factors. And what I like to say from here is this virus does not discriminate, although it disproportionately affects community of colors. If you have these underlying risk factors, this virus doesn't care whether you're an adult or a child. It's going to affect you, and it's going to attack you. And hopefully, if your immune system is strong, it'll fight it off. If it's not, you're probably going to end up in the wrong place. I talk about common symptoms to look for, but I'll let Dr. Hocbo cover that. I'll move on to, this is important here because it relates to that question about this virus does not discriminate. Early on, we thought this was a virus for communities of color. What we've learned now, the majority of people that are dying from this virus are non-Hispanic white. And that's something to soak on because there's been actually a shift in who's actually dying. Not who's actually getting the virus, but who's actually dying. And as of the 24th of May, which was yesterday, we had over almost 34 million cases in the United States and 605,000 deaths. But the rate of deaths are slowing tremendously. And I have to believe that's because of the amazing efforts, organizations like AtlantiCare in South Jersey, Family Medical Center, and the pharmacies, all their efforts to give the vaccine. I mentioned earlier about what we do to control this pandemic. We have the mitigation strategies and we have the suppression strategies, which I covered early on. I just wanted to reemphasize the fact that both of these strategies are ways that we can control the virus, and we have to do both of them to be able to get this and keep this virus under control. The suppression strategy is where we are now with the vaccines. That means you've heard the term bending the curve. Every time we can prevent this virus from finding a host by getting vaccinated, we're in the suppression strategy. And that's how we're going to get back to what you hear also as herd immunity. And I'll let Dr. Hocbo talk a little bit more about that. Okay, I'm getting close to the end here. I'll close on this slide. Can we kill it? Yes, we can. The best way to address it, though, is to get tested and to protect yourself with personal protective equipment, like the face mask. Stay at home. Try to avoid large crowds, although we're leaning into the storm because the majority of us have already been vaccinated and we're opening up the economy. We're going back to work. People are not wearing the mask and people are not, when we have no guarantees that everybody's vaccinated. So I'm a public health doctor, so my first recommendation is always stay on the safe side of everything. That means avoid large crowds if you can. Always wash your hands, always clean and disinfect your work areas and your living areas. Avoid cruise travel if you can, a little bit longer. And if you do, make sure you stay protected while you're doing that. Follow the science, take the vaccine if it's offered. And also, we know things that kill it, that can kill this microscopic organism, things like ethanol, chlorine-containing disinfectant, and even peroxide. And so those things are capable of breaking what I see as the that purple shell around the structure of this virus. It breaks the integrity of that, and that's how we can kill it. So can we kill it? Yes, we can. So in closing, get vaccinated, please. If you're offered an opportunity to get vaccinated, know that people are still dying. Although we've vaccinated at least one dose, over 285 million people within the United States. And we've done a great job since December 14th of December of 2020. In the state of New Jersey, we've got about roughly 47% of our residents that's received at least one vaccine as of yesterday. The target, though, is to get 85% of Americans by the 15th of October, which my hope is that we'll get there sooner. So we got to stop the spread. We got to eliminate the ability for this virus to find a host. And the way we do that is to get vaccinated. And with that, thank you so much.
Thank you, Dr. Washington, for all of the information you presented. Now's the time. If you have any questions, you can, for Dr. Washington, while we have him, you can unmute yourself or place them in the chat.
Okay, well, thank you so much. We'll pass it on to Dr. Hocbo.
Thank you, Dr. Washington.
Hi, Dr. Hocbo. You have control. You are host right now.
Can you see my screen?
Yes.
Okay. So now that we kind of had Dr. Washington had given us an overview of what COVID-19 is, now we have to talk on how can we prevent and how we can keep our community safe. So my talk will focus more on the current mitigation strategies that we have, and the best mitigation strategy that we have right now is getting vaccinated. So I'll talk briefly about the COVID-19 vaccines that are available. So currently in the United States, we have three vaccines that had an emergency use approval by the FDA and has been recommended by the CDC. So we have the Pfizer, BioNTech, Moderna, which both of us has the messenger RNA technology. Pfizer is authorized for use currently for individuals 12 years of age and older. It is administered intramuscularly in a series of 2 doses, 3 weeks apart or 21 days apart. Next, we have Moderna, which is authorized for use for 18 years and older. And I just recently heard, like a couple of minutes ago, that new studies of Moderna had shown that they have good effectivity rate as well for patients that are 12 years old to 17 years old. But currently, we don't have the authorization yet for Moderna to be used in younger adults. For now, it is authorized for use for patients that are 18 years old and older. It is administered intramuscularly, the same with 2 doses, 1 month apart. So this Moderna is 28 days apart. And then the last one that we have is the Johnson & Johnson, which is approved for patients 18 years old or older. It is administered intramuscularly as a single dose vaccine. So just a quick thing on how this messenger RNA COVID-19 vaccine works. So I'm just going to show you a quick video. Let me know if you're able to see it.
mRNA vaccines have been in development for 20 years and are now approved to prevent COVID-19. Unlike some other types of vaccines, mRNA vaccines do not contain any pieces of the virus. Instead, the COVID-19 mRNA vaccine teaches our own cells to make the quote-unquote spike protein found on the surface of the coronavirus, triggering an immune response. In short, they help our bodies produce antibodies specific to the virus.
Oops, sorry about that.
mRNA vaccines have been an immune response. In short, they help our bodies produce antibodies specific to the virus, along with T cells that also confer immunity. That sounds great, right? But I bet you're thinking, how exactly does this work? Well, it works by simply reproducing the same immune response that happens in a natural infection, but without actually infecting your body. Cool, right? Still, there are some common misconceptions about this vaccine. So let's break them down. Number 1, this type of vaccine is new, but is not unknown. Research and development of these vaccines have gone on for decades before this pandemic. Number 2, these vaccines do not affect or interact with your DNA, and the mRNA never actually enters the nucleus of the cell. Number 3, while the vaccine does have some side effects, like the potential for fever and soreness, they do not infect your body with the coronavirus. Side effects after vaccination are not uncommon. Number 4, yes, if you have recovered from COVID-19, you should still consider a vaccine. We still don't know how long immunity to the virus lasts. Number 5, vaccination along with face masks, social distancing, and hand washing is key to resume social gatherings and reopen the economy. Got more vaccine-related questions?
So I hope that quick short video was able to give you an idea how the messenger RNA works. So a couple of things I want to emphasize. It does not affect our DNA. the messenger RNA works like, I don't know if you guys have watched the movie from Mission Impossible. You know, when Ethan Hunt gets a mission, everything just disappears after Ethan Hunt gets the mission. So that's how messenger RNA works. So the technology of the messenger RNA, the vaccine goes into your body to give a signal to your body to produce the immunity that it needs for it to fight um, the COVID-19 virus. Once the mission of the messenger RNA is done, it's being destroyed by your body. So it leaves your body. It doesn't leave anything in your body. Then the next vaccine that we have, the J&J, is a viral vector COVID-19 vaccine. So what it does is that instead of giving you COVID-19 for your body to mount an immune response, this technology uses other viruses to mount your response. So um, it's not giving you the actual COVID-19 virus. It's giving you another form of virus so that your body will be able to recognize if the true COVID-19 virus does come and infect you. So, you know, all over the media as well, there was a time last month when the CDC had to put a halt on giving out Johnson and Johnson, and this was done out of an abundance of safety. Um, you know, it just shows us that the system is working, that the government, the healthcare officials are really looking into potential side effects to make sure that um, the community is safe. However, when the scientists, the FDA, CDC had looked at all the cases of blood clots that it has happened to younger females, um, when all of the data had come in, it was what we saw is that the risk of having a blood clot is very low, and there are more benefits of us getting into having the vaccine instead of the fear of having a blood clot. So this is just a comparison of the three vaccines that are available, the J&J, Moderna, Pfizer. It has a lot of numbers here, but what's important to know is that all of these vaccines are effective in preventing us from having severe COVID-19. It's effective in preventing us from dying from COVID-19. And it's also effective among the different variants that are coming out. You know, normal side effects for any vaccines like injection site pain, swelling, redness, swollen lymph nodes. Other side effects that one might have after getting the vaccines are tiredness, headache, muscle pain, chills, joint pain, fever, nausea, or feeling unwell. Most of these side effects results within 24 hours after getting the vaccine. Just a couple of myths, which was also discussed in the video that I want to emphasize is this vaccines does not change our DNA. It cannot give us COVID-19. It is not the government's plot of tracking us or putting a chip in our body so that they'll know everything that we do. It's not that. And if you have any questions or concerns about the vaccine, please let us know. Let's talk about it. Just this is the latest statistics that was released today from the New Jersey Department of Health. So far, 64.5% of all New Jersey residents 18 years old and older had at least one dose of vaccine. Either of the three had one dose. We had a pretty good rate of vaccinating our elderly population. Those that are 65 and older have an 86% of those 65 years old and older have been vaccinated with at least one dose of the vaccine. This is just shows us the demographics specific by age. So as we said earlier, those that are 65 and older, we've been doing a good job of getting them vaccinated, but we have a lot of opportunities for making sure that all of us, those that are very active, that are in the workforce, are getting vaccinated. As you can see here, for those 50 to 64 years old, only 72% are vaccinated. As the population gets younger, the rate of vaccination goes lower. We understand that 12 to 15, we just started vaccinating them like 2 weeks ago. So we're hoping that this number will go up. But we have a big opportunity to get people vaccinated that are younger. The same thing with people of color. We have a lot of opportunities to encourage one another to get vaccinated. Um, we have 51.7% of those that are vaccinated are white Caucasians. But among us that are Black, African American, and Asians, we're only comprising about 7.7% are Blacks and only 10.7% are Asians. So we really have to go out there and encourage everyone to get vaccinated. Um, we are very lucky to have a mega site that is just very near us. It's in within our neighborhood. The Atlantic City Convention Center continuously provides vaccines to everyone who are interested. Anyone that's 12 years old and older are eligible to get vaccinated. These are the list of appointment times that are available for first and second doses. And even though you have a first dose in other state or wherever, and you want to get vaccinated, please register to the mega site, and so that we can get you your second dose. It is very important to get your second dose. The first dose only gives us so much. We need to have that booster to get our immunity better. We are also accepting walk-ins. If you don't have any, if you're not able to make any appointments, the mega site is open from 8 in the morning to 5 in the afternoon, and we welcome all walk-ins. We're not asking you for any identification or anything like that. All we need to know is your date of birth so that we make sure that you are qualified. But everyone is welcome to come into the Atlantic City Convention Center to get vaccinated. I urge you guys to take this opportunity. So far there are talks that, now that we have vaccinated a lot of people, it's gonna be in a month or so that the Atlantic City Convention Center will be closing. So this is the time for you guys to get your family, your friends to get vaccinated. We will not be leaving the community by closing the convention center. AtlantiCare will continue to work with the New Jersey State Department of Health to make sure that everyone that needs to be vaccinated will get vaccinated. We will be giving out more information once the decision is done on when we will be closing the convention center. But I urge you, I cannot emphasize it more, but we need to get vaccinated, and this is our opportunity to get vaccinated during this time. Let's get this opportunity within this next month to get vaccinated. So just key takeaways about vaccine. Vaccines have played a significant role in mitigating numerous public health challenges and hospitalization. Scientists have innovative biotechnology available to develop potential vaccines faster than before. But we're not skipping any steps. We're not making any shortcuts. Our main responsibility is keeping the community safe. So we're making sure that the vaccines that we're rolling out will be safe. There's a high safety standard for vaccines. Experts support vaccine use based on published evidence. Then the most important thing is get your facts, not the myths. If that's why we're holding these town halls. I know there's a lot of other educations that are going on across our city, is to make sure that you guys get the facts. If you have any questions or concern, as Davis has stated earlier, there's a lot of information available from the Boys and Girls Scout. I know a lot of information is also available through Dr. Washington's office, as well as through the AtlantiCare website. If you go to AtlantiCare website, you will be able to get a lot of information about not only about COVID-19 vaccines, but about COVID-19 in general. And as Dr. Washington has stated earlier, we can do this together. We can prevent COVID-19. 5 things. We have to continue washing our hands, avoiding crowds as much as possible, maintaining social distancing. If you are not vaccinated, we urge you to keep wearing your mask. We have to protect each other. And then the last one is get vaccinated. This is the way to recovery for us to go back to where we were, and at the same time to again stimulate our economy. I think that's the one thing also that we have to look for after all of this is done. Do you guys have any questions? And then I'm gonna stop my screen share so that we can have the panel. Any questions, Dr. Washington? Anything from your side? I don't know if the city has any plans about other vaccination sites.
What I can add is, first of all, we're doing our second vaccines for a number of folks. We did today at the Soldiers Home, or the All Wars Memorial. That was being that was in partnership with Southern Jersey Family Medical Clinic, but we're in certainly direct support and collaboration with AtlantiCare, with the convention center, and we've had a number of mobile teams that's been going to our senior high rises from AtlantiCare, and even some from Southern Jersey Family Medical. So we've actually pretty much been in an all-out war trying to get people vaccinated, and those who want, we've been able to get them on a walk-up basis. I know some organizations around town, like pharmacies, are offering incentives, but I don't think people should get the vaccine because there's an incentive, like a discount or a meal at a restaurant. You should really get it because it's the right thing to do, and it helps protect other folks as well as yourself. So you don't want to be the person that actually caused the virus to find another host and to move on to someone else. So I know that the FDA and the CDC and HHS, my parent organization, are working really hard to get to make it safe to get a vaccine for people 12 down to the age of 12 and even younger, because as we prepare to send our students back to school, especially after the summer, and during the summer where we have all these boys and girls programs and the Police Athletic League, where we're bringing in different sports, basketball, boxing. The world wants to get back to normal. Our kids want to get out of the house and into the recreation. We got softball and soccer and other types of sports. The best way to do that is to make sure to a greater extent that people are vaccinated. We found the vaccines are safe. And yeah, there's been some outliers where people have had some reactions, but those are the anomalies. Those are not and they're the exceptions. They're not the norm. For the most part, these vaccines are very safe, have proven to be very safe, has a very high degree of efficacy. And that's why many people that may have even gotten sick have gone to the hospital, but they negotiate the encounter with the virus and they actually they're coming home. And so the suppression strategy is working. And we need everybody on board, because this is something that is going to take every one of us to do the right thing to keep suppressing the potential of this virus to spread. So that's pretty much all we have. We do have electronic kiosks that are up in our public buildings for people that don't have access to computers. You're welcome to go to any of our public buildings, the Public Safety Building, the City Hall, the PALS, the Police Athletic League, and also Soldiers Home. You'll be able to get information about where the vaccines are. And we're very happy that AtlantiCare has pledged to continue to do the vaccines. until further notice. So let's all lean in. Let's all encourage everybody to get the vaccines. And if you have any questions at all, feel free to call the health department in the city of Atlantic City. And if not us, contact AtlantiCare. Thank you.
Yes, thank you, Dr. Washington. And also, we would like to thank the people of Atlantic City for everything that you guys have done so far. We have seen the decreasing number of cases that are getting admitted. But the thing too is that, we're seeing younger people getting admitted. So we really can do better. And now that summer season is here, we want to have fun. And the way for us to have fun is to be safe and at the same time is to protect each other by getting vaccinated.
Well, thank you, Dr. Hocbo, as well as Dr. Washington again for sticking around with us. Next, we'd like to introduce Miss Tracy Parker, Boys and Girls Club, very own Tracy Parker, to share why she decided to get vaccinated.
Hello, everyone. Again, my name is Tracy Parker, and I am the CovidEd project manager and the site manager of our Boys and Girls Club here on Drexel Avenue. And I just want to share briefly on my experience on why I decided to be vaccinated. First, I'll start with, after coming from lockdown and starting the summer camp as early as July last year, I knew that I would make all the adjustments to continue being safe and trying my best to make all of our kids around us feel safe. But I started to run into an issue where I was getting exposed a lot because I was a site manager. I was a go-to to my kids. I was a go-to to my community. I was a go-to to my family. And it came upon, I realized I was like on my fourth quarantine, meaning my fourth time staying home for 14 days. And I had never contracted COVID, but I was going through all of the different challenges of our pandemic. And it took the last time for me to actually get sick, and it was no longer fun to stay home and work from home. I felt like I wasn't doing a good job as being here for my community and my kids, meaning in person. So I sat home the last time, this time really testing positive for COVID. And I said, I went through months with firsthand guiding this new CovidEd project within the Boys and Girls Club. But I had went through a lot of seminars, a lot of Zooms, kind of, looking at what stuck out to me and my beliefs and how comfortable I was. Obviously, I had family who did not agree on it, still don't agree on it, but I knew that I needed to make a decision for myself. And I needed to be here for our kids, not home quarantined every week. So I woke up and I just said, you know what, today's the day. I'm tired of talking to my kids and everyone through Zoom. I need to be in person. I am more effective in person. And in order to be in person, I needed to now take the next step to protect myself and the people around me. And now moving forward, enlighten more people in my community that who are just not working here in the Boys and Girls Club, but traveling our community, young within my age group. I'm 32 years old. And I wanted to bring that enlightenment, that awareness, and the resources to say, I'm not saying do it because I did it, but understand that I may have had the same concerns of other people. But today, I feel like I have enough knowledge and I trust it enough to go forward and do what we need to do to help us all out. So today I am vaccinated and I am proud to say I'm vaccinated. I am proud to be able to share that I took a leap on what I knew was good for me to better the things around me. So that's my story on being vaccinated. And again, today I won't push anyone to do it. But if you step aside of what you're seeing on TV and hearing on the internet and really put your ear to some resources that really come with factual information behind it, you'll later on decide that it's a good thing to do. So thank you, everyone. Thanks everyone for joining the call. Thank you, Mike, for bringing me on. And following, we will now get ready to pick the winner of the AirPod Pros. So I'm going to hand it back over to Mike Davis.
All right, thank you, Ms. Parker. our quarantine queen. 4 quarantines is a lot. But we're going to pick our AirPod winners now. They're doing the drawing. We're just going to ask that if you are picked, you send us a direct message through the chat, and we'll figure out how to get you your AirPods. We work on picking from the hat, shuffling. Winner is Miss Jamaica Moore. Miss Jamaica Moore.
Yay.
Congratulations, Jamaica. Please contact us directly so we can get you your AirPods.
Yeah.
Right. Got anything to say in winning, Jamaica, besides yay?
I just say thank you to Dr. Washington and Dr. I want to pronounce it incorrectly.
Dr. Hocbo is my
pronunciation. It's a lot of great information, and I'm going to consider getting the vaccine because I didn't get it yet.
Thank you.
It's absolutely wonderful.
All right, well, in closing, thank you again, Drs. Washington and Hocbo, as well as Ms. Tracy Parker, and everyone who came to town hall meeting with us. Our next town hall will be June 15th at 6 p.m. I'm gonna hand it over to Ms.
I'm sorry, I just want to jot in really quick. So yes, our next town hall meeting will be June 15th at 6 p.m. But right before that, we are also hosting our first strike team event here at our Drexel location, where we will have a group of individuals from the state giving COVID testing on the spot. You don't need ID, you don't need insurance. We're just asking to spread that word so we can kind of do a better job on the ground with our community and being safe. Thank you, everyone.
So look out for announcements on social media, on the Boys and Girls Club of Atlantic City newsletter. If you have any more questions or need help finding a test or vaccination appointment, visit acbgc.org/COVID or email one of the community educators at acbgc.org. All right, y'all have a good day.